This is the Mental Health ATI Chapter 2, Legal and Ethical Issues. A nurse who works in the mental health setting is responsible for practicing ethically, competently, safely, and in a manner consistent with all local, state, and federal laws. Nurses must have an understanding of ethical principles and how they apply when providing care for clients in mental health settings. Nurses are responsible for understanding and protecting client rights. Legal rights of clients in the mental health setting. Clients who have a mental health disorder diagnosed or who are receiving acute care for mental health disorder are guaranteed the same civil rights as any other citizen. These include the following: the right to a humane treatment and care, medical and dental care, the right to vote, the rights related to granting, forfeiture, or denial of the driver's license, the right to due process of law, including the right to press legal charges against another person. Clients also have various specific rights, including the following: informed consent and the right to refuse treatment, confidentiality, a written plan of care, treatment that includes discharge, follow-up, as well as participation in the care plan and review of that plan, communication with people outside the mental health facility, including family members, attorneys, and other healthcare professionals, provision of adequate interpretive services if needed, care provided with respect, dignity, and without discrimination, freedom from harm related to physical or pharmacological restraint, seclusion, and any physical or mental abuse or neglect, a psychiatric advance directive that includes the client's treatment preferences in the event that an involuntary admission is necessary, provision of care that with least restrictive interventions necessary to meet the client's needs without allowing them to be a threat to themselves or others. Some legal issues regarding healthcare are decided in court using a specialized civil category called a tort. A tort is a wrongful act or injury committed by an entity or person against another person or another person's property. Torts can be used to decide liability issues as well as intentional issues that can involve criminal penalties, abuse of a client. State laws can vary greatly. The nurse is responsible for knowing specific laws regarding client care within the state or states in which the nurse practices. The Mental Health Parity and Addiction Equity Act of 2008 requires insurance coverage for mental illness. The Parity Act, or State of Equality, requires that coverage for mental health treatment must be considered and reviewed as any other medical treatment. Ethical issues for clients in the mental health setting. In comparison to laws, statutes, and regulations enacted by local, state, or federal government, ethical issues are philosophical ideas regarding right and wrong. Nurses are frequently confronted with ethical dilemmas regarding client care, bioethical issues. The nurse can also experience situations where there will be a conflict between two or more courses of action, known as an ethical dilemma. The nurse should respond to these situations using the bioethical principles. Pharmacogenetic testing can be used to help predict side effects and efficacy with psychotropic medications. However, the FDA does not support genetic testing due to a lack of clinical evidence and research. Because ethics are philosophical and involve values and morals, there is frequently no clear-cut, simple resolution to an ethical dilemma. The nurse must use ethical principles to decide ethical issues. These include the following: beneficence. The quality of doing good can be described as charity. For example, a nurse helps a newly admitted client who has a psychotic disorder to feel safe in the environment of the mental health facility. Autonomy. The client's right to make their own decisions. However, the client must accept the consequences of those decisions. The client must also respect the decisions of others. For example, rather than giving advice to a client who has difficulty making decisions, a nurse helps the client explore all alternatives and arrive at a choice. Justice. Fair and equal treatment for all. For example, during a treatment team meeting, a nurse leads a discussion regarding whether or not two clients who broke the same facility rule were treated equally. Fidelity. Loyalty and faithfulness to the client and to one's duty. For example, a client asks a nurse to be present when they talk to their guardian for the first time in a year. The nurse remains with the client during this interaction. Veracity. Honesty when dealing with a client. For example, a client states, "You and that other staff member were talking about me, weren't you?" The nurse truthfully replies, "We were discussing ways to help you relate to the other clients in a more positive way." Confidentiality. The client's right to privacy is protected by the Health Insurance Portability and Accountability Act, that's HIPAA, Privacy Rule of 2003. It is important to gain an understanding of the federal law and the state laws as they relate to confidentiality in specific healthcare facilities. The nurse should share information about the client, either verbal or written, only with those who are responsible for implementing the client's treatment plan. The nurse should not discuss client information in public places, and social media should never be used to discuss clients or the other information. Only if the client provides consent should the nurse share information with other persons not involved in the client treatment plan. In most states, the dead man statute protects confidential information about individuals when they are not alive to speak for themselves. Specific mental health issues where healthcare professionals can break confidentiality include the duty to warn and protect third parties and the reporting of child and vulnerable adult abuse. If the nurse becomes aware that a client's right to privacy is being violated, for example, if a conversation in the elevator is overheard, they should immediately take action to stop the violation. Resources for solving ethical client issues. Code of Ethics for Nurses, found at the American Nurses Association website. Patient Care Partnership, found at the American Hospital Association's website. The Nurse Practice Act of a specific state, legal advice from attorneys, facility policies, other members of the healthcare team, including facility bioethics committee, if available, members of the clergy, and other spiritual or ethical counselors. Types of admission to a mental health facility. Informal admission. This is the least restrictive form of admission for treatment. The client does not pose a substantial threat to self or others. The client is free to leave the hospital at any time, even against medical advice. Voluntary admission. The client or client's guardian chooses admission to a mental health facility in order to obtain treatment. This client is considered competent and so has the right to refuse medication and treatment. Before release, a client can be evaluated, and if deemed necessary, the care provider can initiate an involuntary admission. Temporary emergency admission. The client is admitted for emergent mental health care due to the inability to make decisions regarding care. The mental health care provider can initiate the admission with this, which is then evaluated by a mental health care provider. The length of the temporary admission varies by the client's need and state laws, but often is not to exceed 15 days. Involuntary admission. The client enters the mental health facility against their will for an indefinite period of time. The admission is based on the client's need for psychiatric treatment, the risk of harm to self or others, or the inability to provide self-care. The criteria for an involuntary admission include the following: manifestations of mental illness, poses a danger to self or others, demonstrates severe disability or inability to meet basic necessities including food, clothing, and shelter, requires treatment but unable to seek it voluntarily related to the impact of the mental illness. The number of physicians required to certify that the client's condition requires commitment varies from state to state, usually 2. This can be imposed by a family member, legal guardian, primary care provider, or a mental health provider. The client can request a legal review of the admission at any time. An involuntary admission is limited to 60 days, at which time a psychiatric and legal review of the admission is required. Clients admitted under involuntary commitment are still considered competent and have the right to refuse treatment, including medication. The client who has been judged incompetent has a temporary or permanent guardian, usually a family member, if possible, appointed by the court. The guardian can sign informed consent for the client. The guardian is expected to consider what the client would want if they were still competent. Long-term involuntary admission, a type of admission that is similar to temporary commitment but must be imposed by the courts. Time of commitment varies, but is usually 60 to 180 days. Sometimes there is no set release date. Client rights regarding seclusion and restraint. Nurses must know and follow federal, state, facility policies that govern the use of restraints. Use of seclusion rooms and or restraints can be warranted and authorized for clients in some cases. Restraints are either physical or chemical, neuroleptic medication to calm the client. A client can voluntarily voluntarily request a temporary timeout in cases in which the environment is disturbing or seems too stimulating. A timeout is different from prescribed seclusion because a timeout, is by the request of the client. In general, the provider should prescribe seclusion and/or restraint for the shortest duration necessary and only if less restrictive measures are not sufficient. They are for the physical protection of the client and/or the protection of other clients and staff. Less restrictive measures, verbal interventions encouraging the client to calm down, diversion or redirection, providing a calm, quiet environment, offering a PRN medication, though technically a chemical restraint and medications are considered less restrictive than a mechanical restraint. The nurse should never use seclusion or restraint for the following: convenience of the staff, punishment of the client, clients who are extremely or physically or mentally unstable, clients who cannot tolerate the decreased stimulation of a seclusion room. When the nurse has tried all other less restrictive means to prevent a client from harming self or others, the following must occur in order to use seclusion or restraint. The provider must prescribe the seclusion or restraint in writing. Time limits for seclusion or restraints are based upon the age of the client. Age 18 years or older is 4 hours. Age 9 to 17 is 2 hours. Age 8 and younger is 1 hour. If the need for seclusion or restraint continues, the provider must reassess the client and rewrite the prescription specifying the type of restraint every 24 hours or the frequency of time specified by facility policy. Clients should never be secluded or left alone in a locked room, unsupervised, or left in a prone or supine position. Continuous in-person or remote supervision is necessary. The facility protocol should identify the nursing responsibilities, including how often the client should be assessed, including for safety and physical needs, and the client's behavior documented, offered food and fluid, toileted, monitored for cardiac, respiratory, and skin integrity, including vital signs, monitored for pain. Complete documentation every 15 to 30 minutes or according to facility policy includes a description of the following: precipitating events and behavior of the client prior to seclusion or restraint, alternative actions taken to avoid seclusion or restraint, the time treatment began, the client's current behavior, what foods or fluids were offered and taken, needs provided for, and vital signs, medication administration, time released from restraints. The nurse can use seclusion or restraints without first obtaining a provider's written prescription if it is an emergency situation. If this emergency treatment is initiated, the nurse must obtain the written prescription within a specified period of time, usually 15 to 30 minutes. Restraint or seclusion must be discontinued when the client is exhibiting behavior that is safer and quieter. Once restraints or seclusion are discontinued, the nurse must obtain a new prescription before initiating restraints again. Tort law in the mental health setting. A tort is referred to as a civil wrongdoing in which monetary damages can potentially be awarded to the plaintiff, injured party, and collected from the defendant, responsible party. Intentional torts are willful actions that damage a client's property or violate client rights. Although intentional torts can occur in any healthcare setting, they are particularly likely to occur in mental health settings due to the increased likelihood of violence and client behavior that can be challenging to faculty and staff. False imprisonment. Confining a client to a specific area, a seclusion room, physically, verbally, or using a chemical restraint when it is not part of the client's treatment, for example, to prevent client harm or to self or others, is considered false imprisonment. Assault. Making a threat to a client's person, approaching the client in a threatening manner with a syringe in hand is considered assault. Battery. Touching a client in a harmful or offensive way is considered battery. This would occur if the nurse threatening the client with a syringe actually grabbed the client and gave an injection against the client's will. Invasion of privacy. Breaking confidences or by taking photographs without permission of the client. Unintentional torts are actions or inactions that cause unintended harm as a result of failing to meet one's duty of care in either a personal or professional situation. Negligence is failing to provide adequate care in a personal or professional situation when one has an obligation to do so. For one to be liable for negligence, it must be proven that the professional had a duty to protect, breached the duty, that the action or failure to act caused injury, proximate cause, and that the injury would not have happened anyway, cause and fact, and that damages occurred. Malpractice. a type of professional negligence consisting of 5 elements: breach of duty, not meeting the standards of care, cause and fact and proximate cause. Did injury occur as a result of action taken by the nurses or lack of action? Did the nurse foresee injury as a cause of their action or inaction? Damages, loss of earnings, property, or causing pain and suffering, and duty, understanding that specific knowledge and skills are needed for specialty nursing like psychiatry. Documentation. It is vital to clearly and objectively document information related to violent or other unusual episodes. The nurse should document the following: client behavior in a clear and objective manner. For example, the client suddenly began to run down the hall with both hands in the air, screaming obscenities. Staff response to disruptive, violent, or potentially harmful behavior, suicide threats, or potential or actual harm to others, including timelines and the extent of response. For example, the client states, "I'm going to pound another client to the ground." Client has picked up a chair and is standing 3 feet from the other client with the chair held over their head in both hands. Nurse calls for help. Client is immediately told by nurse, "Put down the chair and back away from the other person." The client moves away to safe area. 5 other staff members respond to verbal call for help within 30 seconds and stand several yards from client. Client then pulls the chair down, quietly turns around, walks to their room, and sits on the bed. Time the nurse notified the provider and any prescriptions received. All right, a nurse hears a newly licensed nurse discussing a client's hallucinations in the hallway with another nurse. Which of the following actions should the nurse take first? Tell the nurse to stop discussing the behavior. A nurse in an emergency mental health facility is caring for a group of clients. The nurse should identify that which of the following clients requires a temporary emergency admission. A client who has borderline personality disorder and assaulted a homeless man with a metal rod. A nurse is caring for a client who is in mechanical restraints. Which of the following statements should the nurse include in the documentation? Client was offered 8 ounces of water every hour. Client shouted obscenities at assistive personnel. Client received chlorpromazine 15 milligrams by mouth at 10 o'clock. A nurse decides to put a client who has psychotic disorder in seclusion overnight because the unit is very short-staffed, and the client frequently fights with other clients. The nurse's actions are an example of which of the following torts? False imprisonment.